Good evening, everybody, and welcome to another edition of the South Florida Tribune podcast. My name is Scott Morganroth. Glad to be joined by Gary Kornbluh tonight. Tonight's focus is on the 2022 Obamacare open enrollment. Gary, welcome back.
Hey, thanks for having me get back, Scott. I'm excited to talk about Obamacare and how it went this season, this 2022 season.
All right, folks, just so you know, these broadcasts are simulcast. You can view them on the South Florida Tribune YouTube channel. So if you have not subscribed to the South Florida Tribune YouTube channel, I encourage you to do exactly that. They can also be located on Spreaker, Spotify, Apple, Google, iHeartRadio, and wherever else you get your podcasts. So once again, these are simulcast. You can hear the audio as well as the visuals, and we have a lot to bring. And also, you can find these on the South Florida Tribune as well, which is www.southfloridatribune.com. I will mention this later in the broadcast. Want to make sure we got it out there front and center first. With that said, Gary, all right, let's get right to it. So how often do you new insurance companies join the marketplace, and do we know which are the best health insurance to be insured with?
Companies, actually, two new companies joined the marketplace for 2022. So it doesn't happen all that often. But it just so happens that in 2022, two new carriers joined the marketplace. Certainly not new to the business, Aetna and United Healthcare. I mean, they're well-established companies, but they decided to join the marketplace in the Affordable Care Act. So now we have really quite a nice selection of health insurance carriers to choose from, which is kind of interesting. My twin brother owns a property and casualty agency, and he writes auto and homeowners. I think I have more selection with health insurance carriers now that he does with homeowners carriers. So it's very beneficial for the consumer to have these different choices. So and the best ones, really, you asked which are the best companies to be insured with. I mean, all of these companies, from United Healthcare to Cigna, to Oscar, to Bright Health, to Florida Blue. I mean, they're all very similar and offer, similar plans. And of course, they're all vetted by the government, to be included in the program, in the marketplace program, otherwise known as the Affordable Care Act. So they're really all good quality carriers. I guess the best way to answer that question is the best ones to be with are the ones that your doctors accept. Those are probably going to be your best choices. If I'm looking at an Oscar plan and my 5 doctors, let's say 4 out of my 5 doctors take Oscar, but let's say only maybe 1 of my 5 doctors accepts Bright Health, then I'm probably going to focus on the Oscar plan. So again, it really depends on which plans your doctors and your specialists and your hospitals and your urgent care centers. It all depends on who those providers participate in, which plans they participate in.
All right, a question that just entered my mind, Gary, and I want you to think about this before you answer the question. Okay. Our former president was obviously looking to have a different modified plan to eliminate the one. And of course, the current president that we have right now wanted to make sure that, the Obamacare program stayed intact. And then I believe, if I remember right, the Supreme Court ruled to keep everything in place. So tell me, when we talk about how things played out, how much more relieved that you were that you didn't have to start anything new based on what could have happened in terms of what ultimately did finally happen?
I'm extremely relieved, Scott. I mean, let me just say that the past administration, wanted to dismantle the whole Affordable Care Act and the Obamacare program. And I'm glad they weren't successful, because it's really quite a good program. It insures millions and millions of people now. It's the law of the land now. So I was extremely relieved when the Supreme Court voted to keep Obamacare intact. I can't even tell you. And let me just say this. I don't know if you heard, but I've never heard of any plan that was a viable replacement for Obamacare.
Right.
I think that was one of the biggest problems. It's one thing to replace a system that may not work perfectly, but you want to replace it with something obviously that works better and that's tried and true. It's proven. Unfortunately, well, I should say fortunately, there was no other replacement plan that was presented, which meant that Obamacare and the Affordable Care Act remained intact. And yeah, I'm tremendously relieved, as are all of my colleagues. And really, I think the American public is really relieved, because it insures a lot of people. So I think the relief was felt by myself, the industry in general, as well as the consumer.
Now, I know there were concerns at one point, and I should let you know, folks, I have a 215 license as well, even though I am in the media, but I still like to keep one in place. I have an opportunity to write a policy every now and then. That the rates for the marketplace in the Obama program were starting to get a little bit higher. How much truth is that they were starting to get a little higher, and are they starting to become a little bit more under control?
Scott, they actually, I did notice that some carriers did raise their rates this year for 2022, but the fact that most of the tax credits are still available from the tax credits that were available last year carried over to this year, minus maybe some additional credits that were offered through the American Rescue Plan. But I would say for the most part, most of those credits remained intact, and even people in higher income levels were able to get surprisingly, good tax credits. Surprising not just to me, but really surprising to them. When I went through the rates, they were quite surprised that they even qualified for any kind of credit. So it's really helping even more folks for 2022 than in 2021 and the prior years. So it's really, again, as I said, it's the law of the land. It's a great program. I think any administration that tries to dismantle it, I think it may have a very difficult time. They may have a tremendous pushback from the American public, because it's because it works.
Onward we go. So how can I tell if the plan I choose is suitable for me? Can I find out this information on my own, or is it best to work with an agent?
Okay, so suitability is a very important issue. So I would say the most suitable plan really, and it goes back to what I said previously, the most suitable plan really is the plan that, most of your doctors accept, okay? Like the Oscar and the Bright analogy that I made. So if most of your doctors, let's say 4 out of 5 of your doctors take one plan over another, then that's a more suitable plan for you, right? Because you'd like to continue using the doctors that you've been using for years, particularly your primary care physician, because they're kind of like your quarterback, right? And they're going to tell you, they're going to check you, and they're going to tell you if they can, offer a solution to your medical issue, or if they need to refer you out to a specialist. So suitability takes many forms, but I think the most suitable and the first step that a consumer or an agent would take on behalf of the consumer would be to make certain that at least most of their doctors are in this new plan. And if it means that you have to change plans, then that's fine. But again, the more doctors that take your plan, the more suitable that plan is for you. Now, you can find this information out on your own. I mean, many people go on to, healthcare.gov and do it on their own. But here's the thing. I think 100% of the time, these consumers that are doing it on their own are always better off using an agent, because we're trained, we're recertified every year. We know the system better than the consumer, than the general public, because we're trained. And the nice thing is, the consumer doesn't have to pay us. We still get paid, our commission by the carrier. And what's nice is that all of the carriers pretty much pay the same commission to the sales agent. So, I'm not going to, as an agent, we're not going to sway you to one plan or another because of our compensation, because basically they all pay the same compensation. So again, going back to suitability, is, the more doctors that take your plan, the more suitable that plan is. And again, you can do it on your own. You can do the searches on your own. You can search for doctors. You can search for plans, but it's a pretty daunting task. I can't tell you how many people have come to me over the years, Scott, that said they started a marketplace application. They're not sure of what they did. They don't think they're getting the proper tax credits. Some weren't getting any credits at all. So really, it comes down to that garbage in, garbage out. If you put bad information into the system, you're not going to get the best, you're not going to get an accurate solution on the back out of the back end. So you really have to be so careful about the data that you put in so that you're getting an accurate quote and an accurate reflection of your premium tax credit. For a quick example, a lot of people put in the wrong income information. The government is looking for adjusted gross income. A lot of people put in their top line number, their gross income. Well, they're not getting they could potentially get a lower premium if they gave their agent or they inserted the proper income. So that's just one of many areas where a consumer puts in the wrong data and gets the wrong plan out when they go to view their available plans, and when they actually go to select a plan. It may not be the most suitable plan because they did it on their own. So they're always better off working with an agent. They don't have to pay that agent, but they get the expertise and the knowledge that that agent brings to the table. And again, they don't have to pay, right? We get paid by the carrier.
Right. And, I'm glad that you brought that up, and I want to make sure that we hammer that home very much so, folks. These agents and carriers, okay, don't think of the word commission, okay? You're more or less advisors is what you're trying to do to make sure that as long as you're being paid by the carrier, it's your responsibility to make sure that they're working in your best interest. And I use the word commission because so many people tend to get baffled and nervous about the word. So commission isn't the case. It's just making sure that you're properly doing what you've got to do. So I'm glad that you brought that word, because that's the one thing that most people tend to become a little befuddled about. All right. So,
right.
So with that said, Gary, what is a better plan?
Let me just make one more comment about when you mentioned the word commission. I mentioned the word commission because it's something that the government may be looking at. In other words, in the future, agents like myself may have to actually disclose the commission that we're being paid. So that's the only reason. Now that hasn't been decided yet, but I have no problem letting people know, how much I'm making, because really the focus is to make sure that I'm providing the best solution for my client. I think, everybody realizes that if an agent or somebody does good work for you, obviously they deserve to be compensated for it.
Oh yeah, I know. But the one misnomer out there is when people talk about commission, whether it's in-home sales, alarm systems, people tend to become a little overwhelmed with the word commission. And in some cases, whether it's a higher amount, lower amount, in the end, you're still paying for the expertise and knowing that there isn't a big difference one way or the other. It's all about making sure the plan works for you and the payment is affordable so that indeed you're able to get the best care possible. So just want to make sure that some of those things are very clarified so that people don't get nervous about how much you're getting paid, but focus on what they're being, the benefit that they have. And I think that's probably the most important point we're hoping to drive to the average consumer. So with that said, let's go
Absolutely.
ahead. Let's go back to what I mentioned moments ago. What is a better plan, the HMO or the PPO?
That's a very common question. People often, wonder, should I go HMO? Should I go PPO? And what are the differences? Well, again, it goes back to really suitability. And what's the more suitable plan? The more suitable plan, regardless of whether it's an HMO or PPO, the more suitable plan is the plan that most, or ideally all of your doctors accept that plan. Now, if that's a PPO, then maybe that's going to be a more suitable plan. If that's an HMO, then maybe the HMO is going to be the more suitable plan. But having said that, HMOs typically are more suitable for people that really don't travel because they're more or less regional plans. They're in your regional area, regional meaning Palm Beach, county, maybe Broward County, Miami-Dade. So HMOs are typically our regional plans. Now, God forbid, if you're out of state, you have an HMO, and you have a medical emergency, you're still covered, even if it's an HMO, and even though you're out of network. But it's that one situation, it's a medical emergency, and it doesn't matter where you are in the country. You can go to they expect you to go to the nearest hospital or medical center and address that medical emergency, whether it's a life-threatening medical emergency or not. They expect you to go right to a medical center, and with that, you're covered just as if you were in your own regional area going to a local hospital. Okay, now the PPO is really more suitable for the person that does a lot of traveling. Maybe they travel for their business, right? Maybe they just travel because they're retired and they enjoy traveling. Maybe they have relatives that live around the country. So they're probably going to be better suited with a PPO, because with a PPO, you have access to a national network of doctors, specialists, and hospitals. All right. So if you're out and if you live in Florida and you have and you purchase a PPO, and let's say you're in California vacationing, and you need to go to the doctor. Let's say it's not a medical emergency. You think you have the flu or a cold, and you just want to see a doctor. With a PPO, you can do that, because remember, with a PPO, you have exposure to a national network. Okay. Let's say you need to go to a specialist at that point. This primary doctor in California says you need to go to an ear, nose, and throat specialist. Go right there in California. Go right to a participating, ENT doctor, right? And so with that, a PPO, and then ultimately, let's say if God forbid you needed to be hospitalized, again, you could go right to an in-network hospital. All of these benefits would be covered on an in-network basis with a PPO with exposure to a national network. Whereas with an HMO, remember, it would have to be a medical emergency in order to be covered outside of your regional area. And also, let me say that there's distinct differences with HMOs versus PPOs. HMOs are basically in-network only plans, whereas PPOs, there are really a few benefits that are inherently in a PPO. Number one is there's never a requirement to get a referral. So if you go to you can go directly to a specialist, is what I mean. You don't have to go to the primary first. We call that the gatekeeper. Right? There's no gatekeeper with PPO. You can go right to a participating specialist. The other attribute that a PPO has is it offers out-of-network coverage as well. So let's say you had to go to a doctor that wasn't in your network, but you had a PPO. You could still go based on the out-of-network coverage. Now, the costs will be higher, but at least you still have coverage. So essentially, if that doctor or hospital or specialist accept payment from your PPO, you can go anywhere you want based on those out-of-network benefits. And then the last point is the point that I've already made, and that is the fact that you've got exposure to a national network, which again, if you travel or you have relatives all over the country, then the PPO will probably be the more suitable plan for you.
All right, we got a couple more questions I want to address. And I know one of them was a very common question, Gary. What happens if I join a plan and I find out that the doctor is no longer available and takes the plan I just signed up for?
You know, that's such a common question. I mean, I have people sign up for a plan and then they call me back, you know, after January, after their plan started, and they said, you know, Gary, my doctor doesn't take my plan. And I know we searched and we found him in the network. So, you know, that is an issue. That is a problem. Unfortunately, the doctors are not held to the same standards as the Medicare recipient. They seem to be able to join these networks and leave them pretty much anytime they want. You know, I'm not exactly sure what their contractual obligations are, but I have noticed that people sign up and then all of a sudden, oh my God, my doctor told me he doesn't take my plan anymore. So I would say be extreme, you know, in addition to searching, having your agent like myself search and be sure, I actually go one step farther. I'll actually call with my client on the line, I'll actually call his doctor's office and make sure that they accept the plan before we enroll. So I would say whether your agent does it with you or you do it yourself, there's two ways that you can be sure that your doctor is in your plan and will continue to be in your plan. And that is make sure you do the search on the healthcare.gov, make sure your doctor's in the plan and reach out to that doctor and let them know you're switching plans and you just want to make sure that your doctor is going to be in that plan for the upcoming year. So, you know, unfortunately, once you're past the open enrollment period, you're pretty much in your plan, with the exception of this year, where the government extended the open enrollment another month. That was tremendous. That addressed that problem we're talking about, because I was able to switch many people to a new plan that the doctor actually did take. Right, but that doesn't happen all the time. Typically, the open enrollment for Obamacare for the Affordable Care Act is from November 1st to December 15th. It just so happened that the government did extend it another month. That typically doesn't happen. But so again, search and maybe make a call to that doctor to make sure that they'll be in the plan. I would say that's probably the best advice I could give you.
Okay, and finally, if I don't qualify for tax credits and I'm forced to pay full price, are there any options, other ones that are options that are available?
Yes, there are, Scott. If you don't qualify for tax credits, in other words, your income is too high, and there are many people that that are in that position. They make too much money and they don't qualify, so they're forced to pay. They don't qualify for the advanced premium tax credit, otherwise known as the APTC, advanced premium tax credit. They don't qualify because their income is too high. So they're either forced to do one of two things. Or I mean, they could go without coverage, that's one option. That's not a good option for sure, especially during a pandemic. You definitely want to make sure that you have some coverage in force. But they can buy a marketplace plan with no tax credits. They'll pay full price. I have many clients that pay full price for their plan, even many PPO plans. So that's another option. So number one option is go without coverage. That's your worst option. You never ever want to take that option. Okay, but it's an option nevertheless. The best option would be to, of course, take the marketplace coverage because it's full major medical coverage, even if you have to pay full price. But there is another option. And I have a lot of clients that don't qualify for tax credits, right? And I offer them this other option off the marketplace. But the caveat there is that, and the plan is called short-term medical. Even though you can buy a policy for 1 full year, it happens to be called short-term medical. And but the caveat there is that you have to qualify medically for short-term medical, because it's not an ACA compliant plan. They're not guaranteed issue plans like the marketplace plans. All of the marketplace plans are all guaranteed issue. I don't ask my customers any medical questions. I don't need to know. I don't want to know. They all get a policy. The off exchange or the short-term medical plans, you have to qualify medically. So if you're the individual that doesn't qualify for the tax credit because you're making too much money, hopefully you're healthy enough to qualify for the short-term medical, because of the fact that it's not an ACA compliant plan, it's actually medically underwritten. So you have to qualify medically for the short-term medical plans. Most of my clients do, and it ends up being a really good, really cost-effective solution, especially if they do the single pay, because there's really two options. You can pay it monthly, or you can do a single pay option and save another 20% on their annual premium. So yes, so the short answer is yes. If you don't qualify for tax credits, you are forced to pay full price if you want a marketplace plan, but there are other options available, such as the short-term medical. And we actually did a podcast on the short-term medical. So the listeners or the viewers can actually go back to our podcast about short-term medical if they want to hear the details of that type of coverage.
Well, there's no question. A lot of the shows that we do can definitely be referenced on the South Florida Tribune YouTube channel as well. So for those of you that want to watch it, fine as well. And I will go over the providers again, our marketplace version of how the broadcasts are heard in a moment. But the biggest thing that people have to understand, what's so good about the Obamacare program, is it is helpful with pre-existing conditions. I benefited by the program myself many years ago because of pre-existing conditions, and it saved my life. So anytime you have something you thoroughly believe in and you know that you can benefit by it, you certainly want to make sure you reinforce the message. So well done. All right, Gary, as we put a button on this broadcast, is there anything that you want to add before we go off the air?
I mean, no, not really. I think I've covered everything. There's really nothing else that I could really add, Scott. I mean, the Obamacare open enrollment went well. It was a very busy, very active open enrollment. I think particularly because the government extended it an additional month. I think that was a really smart thing that they did. It got a lot of people off the fence, Scott, that were, contemplating coverage. And I think it was really, really good that they did that. I just hope in the future, maybe that becomes the law of the land as well. Maybe instead of being the open enrollment being from, let's say, November 1st to December 15th, maybe going forward, it'll be November 1st to January 15th. I don't know. I'm speculating. I'm thinking that would certainly be nice. It would give us a little bit more time to get enrolled. But, even without that additional month, 45 days seems to be, enough time to review your current coverage and make any changes if you think if either you or your agent feel that you would benefit from a new plan in the following year. But I think that 45 days is probably enough. But again, with that additional 30 days, it created a lot more activity and a lot more people got signed up. So I think overall, it was just a really great open enrollment for 2022. And the fact that those two new carriers came into the picture. I mean, I personally ended up doing a lot of Aetna. It was a very attractive plan. It was Aetna and United Healthcare. United Healthcare came in with an HMO, and it wasn't all that popular among my clients, but maybe in other parts of the country it may have been. But overall, I mean, United Healthcare and Aetna and Bright and all these companies, Cigna, they're all vetted. They're all great carriers, and they all they can all potentially be a solution for you. Again, the focus is make sure that your doctors take the plan that you're choosing.
So with that said, Gary, let people know how they get a hold of you.
So the best way to reach me is really on my cell phone. It's on 24/7. It's area code 561-305-5949. Again, that's 561-305-5949. You can reach me at our office as well. That's 954-532-2060. Or you can just simply log into our website. That's www.medigapx.com. That's MEDIGAPX.com. I'm more than happy to help. So give me a call.
All right, so let me recap a few things here as far as our contact information. If you want to see this broadcast, feel free to do so on the South Florida Tribune YouTube channel. All it takes you to do is simply subscribe for nothing. Then you can see Gary and I talk about this very plan. And of course, you can see his banner ad, which indicates a few of his companies for which he represents. If you're at the bus station or you're traveling and commuting and you cannot watch this show, then by all means, you can listen to the audio version through Spreaker, Spotify, Apple, Google, iHeartRadio, or wherever you get your podcasts. That isn't good enough. Go to www.southfloridatribune.com. And you can also find us on social media on Twitter at Tribune South. So there's a lot of different ways to access a broadcast. And of course, don't lose sight of the fact that Gary writes some stories for the South Florida Tribune as well. So you can find a lot of his stories on the South Florida Tribune. Candy Ebling does a super job putting not only the shows up there on a necessary YouTube channel, as well as all the audio carriers, but the stories as well. So a special shout out to her as well. Without her, of course, it would be hard to make a lot of these broadcasts available. She does a marvelous job. So I know we've talked about covered a lot of ground today, Gary, but this is a subject, Obamacare, that does require a bit more attention. So for all you folks that are watching or listening to the show, my best advice is get a pad and paper and take some notes. You might want to listen to it 1 or 2 times because you're not going to get it on the first go around anyway. So meanwhile, we want to thank everybody for joining us on this edition of the South Florida Tribune podcast. My name is Scott Morganroth, and I'm joined by Gary Kornbluh. So for the next time, take care, everybody, and please be careful about COVID-19, the Omicron. It's still very much out there. It's affecting everybody, so please be careful, and we will catch you on the next episode. Good night, everybody. God bless and be well for now.
Good night, everyone.
Good night.